Dear emergency friends from across the world, I, on behalf of Yashoda Group of Hospitals, Dr. T.S. Srinath Kumar, Group Head, Emergency Medicine. And this program has been endorsed by NBE accredited institutes, that is ANBI, and Society for Emergency Medicine. It's a proud moment for me to present this emergency medicine quiz, which is one of the most awaited program. On behalf of the society, again, I welcome you all, and I request Director Sir, Dr. Pawan, who is always behind us. He is a man who is a leader, and he always believes in one thing, that as a leader, you should not walk alone. You should always walk together. So over to you, Dr. Pawan, sir.
Yes, wonderfully said, Srinath. I could never put it that way. But great. Good evening, everybody. Good evening, good morning, afternoon, wherever in the world you are. And this is open to doctors, nurses, EMT technicians, anybody who has time and patience to log in. So at the outset, I would like to thank Dr. Srinath, who has joined us recently, joined the Yashoda family, but Srinath is well known in the emergency medicine circles. Probably I need not tell too much about him, so probably everybody knows across the country. Is closely associated with SEMI and been pretty well known all over the country. And we have a good set of emergency doctors in Yashoda Hospital, Yashoda Somajoda, Dr. Suresh, Dr. Kiran Verma from Malakpet, Dr. Ranjit from Secunderabad, and a lot of other emergency medicine colleagues. Dr. Naveen is also there. I heard the most for technically savvy ER persons who will be taking care of all the technical issues, saving us some money here too, despite being in the ER background. So on this auspicious day, being Ganesh Nimajan here in Hyderabad, we would be especially we'll like to dedicate this well coordinated behind the scenes effort. A lot of effort has gone in by Dr. Srinath and team to get in a wonderfully organized academic session. This will be everything related to ER, emergency medicine, both for doctors, technicians, nurses. As I said, anybody and everybody will go benefited. We'll try to discuss the latest happenings in emergency medicine. The latest literature, latest journal clubs, and the bread and butter of what exactly goes on in emergency medicine day in and day out. Now I'm in my administrative hat, mostly into admin, managing Yashoda Group of Hospitals, but basically I'm Osmania Medical College graduate from 96 batch, and then I did general medicine in Manipal, and after that I was in US Michigan State University. I did general medicine residency, and then I was in pulmonary critical care in New York, Maimonides, and after that I was working in the US 1 year in Marquette General Hospital and multiple hospitals in US. So I do have a little bit of knowledge from government setups in India, academic setups in India, and then US, and then here private hospitals in India too. So, as an organization, Yashoda Hospital is committed to do our bit to the society, not only in treating the patients, but mostly in disseminating knowledge and sharing whatever we have. As Srinath put it wonderfully, it's not walking alone, because alone we can only make so much, but it's only with a full-fledged team we can make a much bigger difference. And here, not only the doctors, but just be conscious of trying to include everybody in the emergency department also, including nurses, technicians, and not only emergency medicine, but general physicians from everywhere, and critical care. Many of the topics in emergency medicine and critical care, it's almost like overlapping. So I can say that this is my homecoming. And out of all the specialities in in India, emergency medicine is developed tremendously. Before going to US and all, I was not even aware that there was an emergency medicine department. It was mostly done by DMOs, casualty officers, or whatever. There are different combinations, anesthesia. Everybody used to manage, but now it's getting organized into emergency medicine with a clear-cut shifts and exact protocols too, like we have the stroke protocol, cardiac protocols, and all those things. I mean, there is hardly any difference between US and here, at least in the bigger setups. And fortunately, in Yashoda, we are lucky to have one of the best teams. So we would, but this is, we know that we are serving only a very small percentage of the population right now. So we would like to try our best to disseminate knowledge to whatever experience we have, to share it throughout the country, whichever smaller and bigger places, not only in the country, but other places, like particularly as this last 2-3 years I've been in Africa, at least like, I mean, maybe in 20 countries in Africa, I think. So now I can, pretty good experience there. It's, there also system is like, depending on one person being in the ER setup to bigger ones in other places and Asia and other places too. So now world is becoming more interconnected and everybody can log in from everywhere. And the topics, we'll try to get the best topics which is relevant throughout the country and the world. I would say we'll try to pick the best and the latest, and Srinath and Naveen and the entire team will be there to take you over the steps. I think Srinath will talk more about this. Probably we'll have one journal club every month, and the latest topics like cricothyroidectomy or whatever is required, including the videos and all. And to make it more interesting, we'll make it multiple sessions of quizzes, and whatever we do, like monologue myself, like talking continuously will not make much of a difference. So we would like to have it as much interactive as possible. And we have various platforms, like not only the regular Facebook and all other social media platforms like Instagram, Twitter, and all. But I think we have some apps too with Kahoot for something. I'll leave it to the technically more savvy persons to explain, but we'll try to get a very interactive session, please. And if any of you, no question is embarrassing or no, like we will prefer to have interaction with as many people as possible, and we'll try our best to answer each email or each WhatsApp message or each Facebook message, whichever it comes. We'll try to individually answer each one, either immediately or throughout the week. We'll get back to you. And topics also, we may start with some topics and all, but we'll take interactive feedback. And if you like something better or whichever is most relevant, we'll try to take from audience also. And yeah, I think I've taken a little more of your time, but today, being Ganesh Nimajan too, our emergency medicine team is like more than any other department. Our emergency medicine department is fully prepared. If something happens, any kind of emergency, from mechanical accidents to fire or drowning or whatever happens, because first point of contact is emergency medicine. And in US, they used to joke, nobody likes emergency medicine because nobody wants to take the patient. But no, that's only joking. But emergency medicine is the most critical one, because in that first 5 seconds or whatever, when they come, you have to decide, and everything runs through a good medical emergency department. And especially, once again, I thank all of our emergency medicine team led by Dr. Srinath too. I think have a best team, and we encourage all of you to contribute and take this interactive academic session, because a lot of people will benefit. I mean, we doing myself or individually or one organization will make some difference, but to make a biggest difference, this has to be amplified throughout the country and the world. And we should try to do our best to share whatever we have and take feedback and modify accordingly. I think, Srinath, you want to take over from here?
Thank you very much, sir, for your insight, and always you have been academically so strong, and you're pushing all of us into academics. And it's a good beginning. As you rightly said, today is the most auspicious day in our country. And so we have started this webinar series. As sir has rightly said, ER is the face of any hospital, and any patient coming at any particular time, we have always proved that we will be the one in the healthcare service. And then apart from that, we all know that COVID had hit us a lot, but when it started, the three departments which never said no was, first one was the emergency medicine department. So we said that yes, we are there with the hospitals, we are there with the patients, we are there for service. So as you all are aware, the motto of the Society for Emergency Medicine India is three things. One is academics, two is research, and three is service. And rightly, we led the whole team and we took the care of the patients, not 1-2 lakhs of patients. And our families were sitting behind helping us. And all the hospitals which are present here, they were very, very supportive. Especially, I am aware that even though I've joined Yashoda recently, but I'm aware that past 10 years, how the emergency department has grown in Yashoda and how it has been contributed for the service of the patients. It is very great to be and honored to be with all of you. So with these few words, just to give a reminder that every week on Friday, please mark your calendar between 6 to 7 p.m. We have kept this webinar series, which will be helping you all, the residents, in various topics like what Dr. Pawan sir has said, that various topics in emergency medicine, especially from Tintinale, will be covered. And every month end, we'll have a journal club and regular quiz programs will be held. It will be helpful for all your examinations. Let it be your MRChem, let it be your CCTM, let it be your MD emergency medicine or DNB emergency medicine. So this will be the right track for you, for your patient care, as well as your academics, as well as your research, and also last but not the least for your exams. So now, so I will hand over now to Dr. Naveen, who will be taking over and doing the quiz program, which is set for today. Thank you all for the patient listening. And I again thank all the management of the Yashoda team for supporting me for conducting this program. Dr. Naveen, please take over.
Good evening, everyone. So we will start with the quiz. Now we have 27 teams that have already joined. So we'll go through the questionnaire now. So how it runs is you will be seeing the questions on the screen. Then on your mobile screens, you will get the options where you can input your answers. So the timer will run. So based on the time you take, you will get points. Say if it's running for 1 minute. So those who are answering in the first 10 seconds will get higher marks than those who take time to discuss, to look up on the internet and all, they will lose some points. So don't worry about losing out to those who use internet and cheat. So they will obviously get less marks. So we'll start with the questions. Okay, the round one is about basic sciences. So we will look at the question. First question. The person is unable to see both temporal fields. Where could be the lesion? You have 25 seconds to answer. Okay, we have 24 answers. Of them, majority have chosen optic chiasm as the answer. So the next question. So this is how the top scoring people are. So team anaerobic 972. Like that, after every question, you will be seeing the scoreboard. Now question number 2. Which tracts carry fine touch and pain sensation of left side body? Okay, we have 14 answers as right spinal thalamic. Let's just see. Next question. Which sinus is damaged in blowout fracture that leads to diplopia on upward gaze? 30 seconds to answer. Okay, 14 people got it right. Next. Which is not related to the safe triangle? Everyone has answered, so let's keep this. Next. In a trauma case, the EFAST is positive. Which organ could have been injured? Okay. Next. So 6 players have answered the last 3 questions correctly. After a neck injury, the patient is unable to adduct or abduct his fingers. Which nerve could have been damaged? Ten more seconds. Okay, ulnar nerve is the right answer. So they're asking about the pad dab section. So that's by ulnar nerve. After a stab wound to the neck, the patient is unable to shrug his shoulders. What could be damaged? Okay, not bad. Which nerve is most susceptible to the damage after lunate dislocation? Okay, the median nerve is most susceptible. That's the right answer. Next. You notice foot drop and loss of sensations in first web space. Which nerve damage could lead to this? Okay, that's the deep fibula. Okay, that's Clemens Crony still leading. Next question. As per Starling's law, how would the curve shift with a positive inotrope? Up, down, left, right. Shift up is the right answer. Next. Doubling the radius of a blood vessel will change the resistance to. Okay, that's 16 times slower. Next. Which fluid compartment doesn't belong inside the cell? Ten seconds. Time up. All of them, extracellular, interstitial, plasma, all of them are outside the cell. Next. Pacemaker potential is primarily due to the influx of which ion? That's the calcium. Remember, the faster you answer, the higher your score will be. What happens ultimately when a person is given hypotonic saline? That's right. Cell will gain some fluid and it becomes swollen. Resistors are pretty close to the first place. Okay, next. How to calculate MAP? Okay, next. Regarding oxyhemoglobin curve, 3 of these shifted to one side, but the other one shifts it in opposite direction. Which is it? So I've given more time for this. Think over. Okay, that's increase in pH. Increase in H plus and increase in pH are not the same thing. I see some tables are turning. Next, S1 sound is due to ten more seconds. Okay, closure of tricuspid or mitral is the right answer. Next. How do you calculate cardiac output? You just have 20 seconds. Nice. Only one wrong answer. Next, lungs have small amount of surfactant. What's its role? It helps reduce the surface tension. Next. A known DVT patient is on warfarin. Starting which of these drugs will render warfarin less effective? Last two answers. Okay, it's about cytochrome P450 inhibitors, and so the phenytoin is the right answer. Nice to see a new top position. That's from 3 joules. Next. Which electrolyte abnormality predisposes a patient on digoxin towards the toxicity? 20 seconds. That's hypokalemia. Some people have answered hyperkalemia, but digoxin toxicity will cause hyperkalemia, whereas hypokalemia will lead to toxicity of digoxin. Next. Cremensor Prague. Next. You're treating a nerve gas poisoning with atropine. Which effect is not reversed by it? Last answer. Okay. Next. Which of these local anesthetics has the longest duration of action? Bupivacaine is the right answer. If you have levobupivacaine, that would also be the right one. Okay, that finishes our basic sciences. Now let's look at some life-threatening emergencies on round 2. Get ready. 70-year-old hypertensive presents with palpitations since 2 hours. BP is 80/40, heart rate 150, respirations 20, SATs 98% on room A. Temperature is normal. You can see the ECG. Okay, this is an unstable tachycardia, so it needs synchronized cardiovascular. Pheochromocytoma patient has severe hypertension. Which should be your choice to treat him? Ten more seconds. Okay, you'll have to use an alpha blocker first. Only then you can go for a beta blocker. So phenoxybenzamine is the right answer. The top question has just changed to research status. Next. A 30-year-old is rescued from a frozen lake in cardiac arrest, and this is the ECG. So temperature is 28 degrees centigrade. What's your next step with CPR? Yes, active rewarming is needed. A medication vial says 4% lidocaine. You need to give 40 milligrams of drug to someone. How much will you draw into the syringe? We have given you 1 minute to answer this. Just 3 more answers. 20 seconds. So when a vial says 4% lidocaine, that means 4 grams of medicine in 100 ml, 4%. So 4 grams in 100 ml. So 400 milligrams in 10 ml, 40 milligrams in 1 ml. So 1 ml is the right answer. Next. A 53-year-old in cardiac arrest after PTCA. So ROIC was achieved after 10 minutes, but the patient is still drowsy. Will you start TTM or not? It's nice. You need to start again. Okay, from first position to fourth. 30-year-old, 80-year-old, lower limb cellulitis plus fever. Heart rate is 120, BP 70 by 50, respiration 24, 26, SATs 96% on room A. Sugars are high, lactates are 6, hemoglobin is 7.2. What's the next? What is inappropriate in this situation? What should not be done immediately? Yes, blood transfusion can wait while you take care of the sepsis. No change in positions. Good. 16-year-old female after road traffic accident. Heart rate is 100, BP 60/40, respiration 23, SATs 92% on room A. Pelvic fracture is suspected. Which of these is least priority? Yes, SATs are good enough. Same positions. Next. Which is not a feature of high quality CPR? 20 seconds. Yes, the rate should be 100 to 120, not 140. Next. Road traffic accident patient, heart rate 122, BP 84/60, respirations 44, SATs 70% on room A. Trachea is deviated to the left. Chest X-ray shows tension pneumothorax. ICD is placed. Which of these is not indicated? Which is unnecessary in a tension pneumo case? So tension pneumothorax, if that's suspected, that has to be a clinical diagnosis. You shouldn't order chest X-ray for it. Next. End-stage renal disease patient misses dialysis. The ECG is shown below. What's your next first step? So the ECG is clearly showing some changes regarding hyperkalemia. So you need to first give calcium, then rest of the therapies. Next. 40-year-old female on hypothyroid and type 2 diabetic milk pills, also oral contraceptive pills. Shortness of breath since landing 1 hour ago. Sinus tachy, BP 100/60, respiration 30, SATs 94% on room A. What could be the probable diagnosis? Yes, that's pulmonary thromboembolism. No change in positions. Nice. Patients with mental health issues has consumed 45 unknown tablets. Hemodynamics are unstable. What could this be? Ten seconds. That's the reverse tick sign that's been shown. So that's deoxin toxicity. Next, 50-year-old with recurrent chest pain on exertion, settles on rest, no family history of cardiac disease, ECG is fine. What could this be? If something relieves on taking rest and comes up only with exertion, that's stable angina. 83-year-old female, CKD patient, worsening SOB, severe at night, no chest pain, fever, has bilateral palpitations, chest X-ray is shown. What is the diagnosis? Seven seconds. That's right, it's fluid overload. In trauma assessment, which of the following can be identified during primary survey? Cardiac tamponade, that's right. Change of places. The resuscitator is on top now. A diabetic has stopped taking medications, complaining of nausea, drowsiness, heart rate is 93, BP 110/70, respiration is 22, SATs 100% on room 8, VBG shows pH of 7.3. What are the features of HHS? Hypovolemia, hyperglycemia, and hyperosmolar state. A young female has vaginal bleed. You are suspecting ectopic pregnancy, which is of no use in diagnosing or managing this patient. Five seconds. Yes, LFTs are not important immediately. Fifth place has changed to crash cart. A case that is looking like anaphylaxis is not responding to adrenaline. All family members have had similar results in the past. So what to do next? It's looking like anaphylaxis, but not responding to adrenaline. There is family history. Okay. So that's C1 esterase inhibitor deficiency. Sixty-year-old male having headaches and jaw pains in 6 months, now complaining of loss of vision in one eye. You're suspecting temporal arteritis. How do you diagnose it? Fifteen seconds. Biopsy is the right answer. Next. No change in positions. The round 3. So this is actually the last round. We are skipping the 4th round. So the pediatric emergencies is being tested on round 3. A 4-year-old girl presents to the ED with impetigo around her mouth and nose. Most likely method of spread. Twenty seconds more. Breach of intact skin is the right answer. Okay. Of the top 5, only 2 teams have scored marks. Next, if father brings his febrile 9-week-old child to the ED, the child's vaccinations are fully up to date. Which of these is still pending? I'm expecting some change of positions on the leaderboard. Moms. MMR is pending. There's a slight change. Okay. Next. 8-day-old boy with 1-day history of red eyes with purulent discharge. You're suspecting chlamydia. The kid is at risk for what? Pneumonia is the right answer. Just one team scored among the top 5. 14-year-old known von Willebrand disease has bleeding wound. Which aspect of homeostasis is abnormal in this? Addition of platelets is bad in von Willebrand disease. You're suspecting pertussis in a 3-month-old baby, which is the most common complication in this age group. So that's apneic episodes. That's the right answer. Eight-year-old hemophilia boy presents to the ED after a fall with a warm, painful right knee. Which clotting factor is needed to treat this? Factor 8 is the right answer. Crash card just came into top 5. Congratulations. You have just intubated a meningococcal septicemia kid and shifted it to the ICU. Who will need chemoprophylaxis? So the doctor who has intubated the kid needs prophylaxis. No change in positions. Regarding the key clinical features of Kawasaki disease, which statement is correct? You have 60 seconds for this. Petechial rash should prompt for an alternative diagnosis. Clemens Crony, that's back to top 1. You have a suspicion of pulled elbow in a 2-year-old. Regarding X-ray of elbow, yes, that could be normal and it's not necessary. Next. Which of these is a false statement regarding viral laryngotracheobronchitis? False statement. Next. Regarding lower GI bleed, choose the mismatched diagnostic modality. Yes, HUS cannot be diagnosed just with history. Just 30 points between place 1 and 2. Let's see. You have a kid in the ED who is having shortness of breath. Which of these is not a marker of inspiratory distress? Yes, pursing of lips is not a marker of inspirated distress. The other three are. No change in positions. You have a kid with gastroenteritis. If weight is 10 kgs and estimated dehydration is 10%, what's his fluid deficit? 30 seconds to answer. You need to know the formula to answer this. That's 1000 ml. That's the right answer. No change of positions. Nice. Ambulance brings a fitting child. EMT tried buccal midazolam. You have tried rectal diazepam. The patient is still seizing. What to do now? You have to give phenytoin now because you have already tried midazolam and diazepam. So benzodiazepines have to be given only twice, not more than that, including any pre-hospital medication. Last question. Identify the abnormality on this X-ray. Most of you answered correctly. That's Perthes disease. This ends the quiz. The top 3 is 3 joules. Top 2 is the resuscitator. Top 1, Clemens Cornix. By the way, they are from Singapore. Next, 4 and 5, that's jack of all trades. Dr. Srinath, you are on the screen.
Yeah, thank you. Thank you, Naveen. It was an excellent show. And I should really thank my co-host, Dr. Naveen R. Nimula, for hosting this whole show. From day one, when I said just one thing that we should run this quiz program, he started looking into his innovating ideas, technological services, and then he brought out this whole program, which came into the fore. And when I brought out the advert, it was very nice to see so many of you had come forward to participate in the quiz. So I really thank each one of you for participating in this particular program and making it a very successful one. Of course, this program is also live streamed on Facebook, so you can also view it later on the part of the day. And I would also like to thank my other emergency colleagues, Dr. Suresh, who is the head of emergency department at Yashoda Hospitals, Somajiguda, Dr. Ranjit, who is the head of emergency department at Secunderabad, Dr. Kiran Kumar Verma at Malakpet, and all other consultants who are working in emergency department. I would like to thank all the course directors for allowing their residents to participate in this particular program. And I also would like to thank my tech team, Mr. Pavan, who is led from the front and ensure that the whole program is being done properly and also doing it on Facebook Live. And for all the digital branding, which has supported me for conducting this first program, which has been telecasted worldwide and viewed worldwide. I don't have words to say, express to my semi-board members, starting from my president, Dr. Venkatesh, Secretary Dr. Saran Kumar, Joint Secretary Dr. Sai Surinder, Treasurer Dr. Saujanya Patibandal, and also my dearest colleague, Dr. Imran Subhan, who is Head of Emergency at Apollo Hospitals, Hyderabad. And there are many, many people who are involved in this, who are always supporting me from the forefront to be in the academics. Thank you all, my friends, for being there with me throughout my life. And this is just a start of the beginning, because I always thought that webinars should be conducted regularly, which will be very, very helpful for all the residents. And it will also be a good base for them to carry on for their whole life. Without academics, it is not complete in residency. So with these few words, if I missed out somebody, I'm very, very sorry for that. I asked Dr. Naveen to give his closing remarks, and then these vouchers which have been there, I will be sending it to you on the mails which you have registered for. Thank you all. Jai Hind.
So I should thank my co-consultants who have helped me with making these questions, Dr. Prasad and Dr. Akila, and Dr. Manvita in helping out with the WhatsApp chat histories and all. So we will come back to you with whoever has won. Top 3 teams will be contacted via WhatsApp on how to receive your prizes. Thanks for joining.